A rising incidence of brain drain in the medical profession is our focus this morning, and we do have a medical doctor, a professor of medicine, Professor Godwin Maduka. He will be telling us some of those factors responsible for the brain drain that sees a lot of medical professionals in Nigeria moving out in droves to other countries to practice the profession. Thank you so much, Doctor, for
Thank you very much.
All right, so for you, what are some of the reasons, that leads to these issue of people leaving, migrating from Nigeria after having been trained, resources spent on them and all of that?
Well, as you can see, most people that are trained here, some of them decide to live in Nigerian soil, to go to places like US or UK. Some of them go there for extended period of time to get more training. And some of them go there to also get better jobs. But the main reason I think that we have this brain drain is the quality of residencies and fellowships. And when they go to US or UK to extend their training, most of them will decide to stay over there.
So these are special cases. I think that these are doctors who perhaps have the opportunity to go to other countries for fellowships and, of course, residencies and decide to stay there. How about medical doctors who were trained by the Nigerian government, for instance? A lot of investment made on these individuals who leave this country to practice in other countries. What do you think are the major reasons, the major factors responsible?
Well, most physicians, when you were trained, whether it's in Nigeria or somewhere else, they like to practice they like to practice what they have learned. But you can see in Nigeria, we still have some ill-equipped hospitals. A physician like to use what they know and the equipment they have to use to practice medicine. Medicine is advancing every day, and if you're ill-equipped to practice what you have specialized in, it will be difficult to get that career fulfillment when you're here in Nigeria. And now there should be a need to increase it, or invest more on equipment, invest more on stable, for example, stable light for laboratory equipment and things like that. So some of the factors that are draining the nation of well-trained physicians is actually the having a conducive atmosphere to practice.
If I bring this question to you, what would you say was your own reason? Because I'm sure you've also had an experience outside the shores of the country. Or what was your own peculiar reason, for leaving? And you are probably back, maybe practicing here?
Well, I never trained in Nigeria. After high school or secondary school, I immigrated to US to go to school. I ended up doing chemistry, doing doctorate in pharmacy, doctorate in medicine, and proceeded to Harvard, where I did my training in critical care, anesthesia, and minimally invasive spine surgery. But there's this need for some of us to come back home here, and which is what I have done over the years. So I think my case is a reverse of the process.
Okay.
Mm-hmm. So you never really practiced in Nigeria, so it's going to be very... But you've heard tales, you've heard accounts of physicians practicing in Nigeria, and of course some of their challenges and limitations, one of which is poor remuneration, the absence or lack of hospital facilities. And so it makes them to abandon Nigeria for greener pastures.
You see, medicine is something that when you get into it, you really want to have passion for what you do. Some of these people or these doctors, as you say, that I see in US, very smart people. Nigerian medical education is still one of the best. There's no cutting corners here because I meet them over there, either as a professor or as colleagues. So the training of our Nigerian doctors, number one, is a remuneration, paying them better, having equipment to work with, having stable light and water, and things like that. So the main thing, and also you want to be a good doctor. You want to be at the cutting edge. You want to compete with everybody else in the world. But you can't do that if you have never been exposed to these new gadgets. We're doing robotic surgery now. We're doing all kind of stuff. So if we invest in the area of health, both in the training as well as the conducive atmosphere for people to practice, they are going to the green shore, number one, to fulfill what they have learned to do. Two, they want to be paid more. Three, they want to be in a society where you can actually save life. Now, we had horror stories where people don't even have oxygen. Or somebody sustained a cerebral vascular accident, which is stroke, and there's no emergency medicine to give them there that will reverse the sequelae of that problem. So as a physician, most people are leaving the shore, both for the money, as far as the conditions, being able to practice with the recent equipment you need, and the drugs.
So in essence, Nigeria is producing doctors for other countries?
Yes, they are really. And these are very smart. I have nephews and nieces that they're going to school here. I had the opportunity to train or to teach Nigerian doctors that come to US, and you come to find out that given the same opportunity, given the same atmosphere, they will do well. We're losing a lot of lives here. People are dying.
There's an investigation carried out by one of the traditional media in Nigeria that revealed that even though exodus of doctors isn't entirely new, but the number has increased in the last 2 years. So we see doctors going to countries like the United States, United Kingdom, Canada, Saudi Arabia, and the rest of it. Now, is it possible to reverse this trend, and how?
Thank you. I think it's really very easy. You have to start from the government. Where, you know, a very healthy country is a very rich one. I mean, we're not just doing brain drain of the doctors, we're also doing the draining of our pocket when we go overseas to seek for the care. Okay? So how is the government intervention, whether local or federal? It's going to be a serious problem if we don't stop it right now. We have to be able to get some expatriates or doctors from all over the world to have enough incentive to train our people here so that we stay here. Pay them well. The quality of life has to be improved. So my thing is, how do you stop the brain drain, fill their pocket, that will go along with the level of education they have done? I mean, and how do you do that? The individuals can't afford the level of care that these people would have acquired. So the main thing is to increase, I don't know for sure, but we need to increase the budgets that goes to health education, training doctors and nurses, getting our hospitals to be well equipped, maybe use solar energy to stabilize the light that is in the hospital.
But looking at what is happening in the country, because I'm sure you interact, you get to meet people, have feedbacks. Do you think that Nigeria is on the path to stopping this brain drain in the medical profession, or we're still going to have more people, leave the country?
As it is now, more people are still living. I mean, and these are very smart, intelligent doctors. And most of these Nigerian doctors are very young. I mean, in social media, they see what we do over there in US. And some of us are worried. That's why we're coming home to establish things like this. So there's going to be more people living. Unless we intervene right now, invest more, like I said, in medical education after they graduate as doctors, establishing residencies. We can't just depend on the Nigerians alone to teach. Getting people from outside this country, making it easy for them to come into the shore of Nigeria and teach them here. Everybody really want to be home. They want to be home. I don't think most of the people that actually went overseas want to be there. They still have loved ones here in Nigeria.
There was an Abuja declaration that, suggested that 15% of the annual budget should be dedicated to the health sector. But no state in Nigeria has been able to meet that particular mark, not even the federal government. Now, how do you think this could affect the provision of medical services in the country?
Well, if we don't have the budgeted amounts for the education, we're answering the same question over again. I mean, we want to have enough fund, either through the Department of Health, should go directly, and the federal government could actually be the ones that will deal with this issue. Because the point is that some of these revenues, if it's actually brought to help the health, where does it really go? I mean, my thing is, if the states don't have the money allocated for the health, how do they practice? How do the doctors practice? How do you have the conducive atmosphere? How do you have the labs? I had somebody who had a traumatic injury, and they need to have MRI or CT scan. There's none to be found in many miles away.
Okay.
All right. Professor Godwin Maduka, Professor of Medicine, has joined us this morning, and we've looked at the issue of brain drain in the medical profession, and he says that there is a need for increased budgetary allocation to the health sector because most doctors want to stay. So it is a question of political will. If other countries have done it, then definitely Nigeria can do it. Many thanks, Professor Godwin Maduka, for joining us.
All right, we do have another interview.
Yes, we do.
We'll continue our series on agricultural productivity and extension services after this break.
Do stay with us.
I think she's got the hots for me. I think she lied.